Hey everybody, this is John Oxley at Huntington Physical Therapy. This week's Friday Tip of the Week is going to be the second part of our two-part series on shoulder pain. For those of you that watched last week, we showed you some spine mobility activities to first do when you have some shoulder pain, because spine mobility is really the key to improving shoulder problems, especially in you 40, 50, 60-year-olds. So today we're going to discuss some mobility exercises you can do for the shoulder once you have worked on that spine mobility stuff from last week. Just a few seconds or a few little tidbits on shoulder pain. If you're getting pain here, it typically is referred rotator cuff pain. To get rotator cuff pain, it does not have to be always on top of the shoulder. And often people come in, they've got this pain, or they have trap pain that they're associating with their shoulder problem. Often trap pain, medial border, or scapular pain is coming from the neck. But we would have screened that out, and today we're going to make the assumption that you are just limited in your shoulder mobility and you have already started to work on your spine mobility. So let's go to a couple exercises and then we will wrap it up in a few minutes. This exercise that I'm going to give you is probably my favorite exercise to give people with not only mid-back / thoracic spine mobility problems, but also tightness through the chest, which is a lot of us because here we sit at a computer, which we discussed last week. So you need to find an empty corner, which a lot of times is a struggle for people, but find an empty corner. Usually the back of a door works really well. Shut the door. Arms are going to go up at 90 degrees here, and I'm going to lean in and try and touch my nose to the corner. Usually what I'll have people do with this is hold it about 3 seconds and do 10 of them. Try this exercise, see if it hurts. If it does hurt, you can tweak it just a little bit. You're going to do the same thing, but drop your arms down a little bit and lean in. And it may feel a little bit better. For some of you that are suffering from a lot of shoulder pain, this exercise may be too aggressive, and we may need to give you something a little bit easier to stretch that out. The second flexibility exercise I'm going to show you today is what we call a posterior capsule stretch, but really a cross-arm body stretch, because we're trying to stretch the back of the shoulder a little bit. What you're going to do, you're going to bring your painful arm up, take your good hand, pull the elbow, and bring it up almost like you're trying to strangle yourself. As you get better, you can bring the arm up and across like that, but if you're pretty sore and painful with it, you want to start low and try and get that easy stretch there. Again, hold it about 3 seconds, do about 10 repetitions, and as you get better, you can gently and easily start moving it up till you get it all the way across. So for your third exercise, you're going to get a broomstick or a cane, lie flat on your back, on the floor, on the bed is fine. You're going to put your hands about shoulder width apart. Start here at 90 degrees, and then you're just going to take this stick, broomstick, cane, whatever you've got, overhead, far as you feel like you can, and get a nice stretch. A lot of times that stretch will feel like it's in the armpit. Sometimes it feels like it's behind the shoulder. I do 10 to 15 reps, and really I do that a couple times a day to really work on that shoulder flexibility. So there's 3 easy flexibility exercises you can work on if you're having some shoulder pain, some shoulder flexibility issues. Anybody that knows me knows that shoulders are my thing. They're really my passion. Those are not the only exercises to do, obviously, but it can give you a good start, especially if you're not really ready to go to a physical therapist or a doctor yet and you want to do some work on it on your own. And I think that's perfectly fine. But the longer these things last, the longer they take to get better. So keep that in mind. Don't let them linger. And a lot of times when they're fresh and new, they're easy to get better fairly quickly. hopefully this week's video was informative for you. Keep the feedback and the questions coming, and we've got some new videos lined up for the next couple weeks that I think are going to be fun and you'll enjoy. Thanks, and have a good weekend.